Fortunately, Wilson disease takes that whole carefully crafted mechanism and then flushes it down the toilet. Wilson disease is an autosomal recessive loss-of-function mutation in ATP7B, the enzyme that coordinates where copper goes in the hepatocytes. Without ATP7B, ingested copper can neither be excreted nor incorporated into ceruloplasmin, which is a big problem. First, since copper can't leave the body normally, it just builds up in the liver, causing hepatocyte inflammation and ultimately necrosis and eventually cirrhosis. And here's an important point of distinction. I keep making comparisons to hemochromatosis because they both involve heavy metal buildup and primarily cause liver damage. But copper doesn't take as long to build up to hepatotoxic levels. These patients actually start to get cirrhosis before the age of 40, sometimes a lot earlier. Once the hepatocytes start to become saturated, copper starts shooting through the portal system into the systemic circulation without binding to ceruloplasmin first, causing excess free copper to deposit in some weird places. The CNS is one of the most commonly affected besides the liver, and one of the key board-testable features is the Kaiser-Fleischer rings, literal rings of copper around the corneas. But the more common and more serious features involve the basal ganglia deposits, which lead to a lot of Parkinsonian features and movement disorders. You'd expect that, right? Because the basal ganglia are heavily involved in movement gating. Also common to Wilson disease is a whole host of psychiatric problems, ranging from depression to frank psychosis.